extraordinarily innovative, smart country, and we are spending more money than we would spend if we were actually exercising any, discipline over how we spend it. We spend nearly $2 trillion a year. That's 50% more than the next highest spending country, Switzerland, and they insure everybody, and most countries that have universal healthcare systems have better outcomes than we do, and a lot of countries that are a lot poorer than we take care of preventive health care better than we do. I talk to my friends in boardrooms or CEOs of companies all the time, and I say, if this were a commodity other than healthcare that you were spending so much money on and getting so little in return, you would never put up with it. And yet, here we are. We are allowing ourselves to have more and more uninsured people and more of what I call the underinsured. That means you've got insurance, you actually have the policy except when you need it. Your doctor says, well, here's the procedure, the intervention that you require. The insurance company says, we're not paying for it. Now, I don't think, that any of us have, escaped that experience either personally or through someone we know. And so our insurance company is basically making medical decisions, basically determining the outcome of our health care, and in most instances refusing to pay for preventive care. So we have a system whose incentives and rewards are all upside down and backwards. Take any disease. I always take diabetes because we have an epidemic of diabetes, and we have more and more people being diagnosed with type 2 diabetes. And most insurance policies will not pay for you to go to a podiatrist to have your feet checked, will not pay for you to get nutritional counseling, but if you have to have your foot amputated, they'll pay for the surgery. And that's because, very honestly, they'll tell you they can't escape that. But they don't want to make the investments in prevention because you might change policies and they won't realize any return on their investment. So the costs for everybody just keep going up. So I know we can do better, and we finally have the moment where that can happen, because obviously I tried back in 93 and 94 and still have the scars to show for that, but people have really learned a lot more about the problems and what the potential remedies are. Secondly, we have to set a goal of moving ourselves toward energy security and dealing with global warming.